Right, welcome to my video where we're going to discuss acne. What causes it, who gets it, what can we do about it? Okay, so we do know that acne is caused by hormones usually, causing an excess of an oily substance called sebum. And this, along with dead skin cells, blocks the hair follicles in the skin. This is an ideal environment for bacteria to come and sit and congregate, causing inflammation and spots. So who gets acne? Well, it can run in families. So if your mum and dad had acne, there's more chance you're going to get it. But sometimes it just happens out of the blue. And we do know women tend to be more likely to get it than men. And when they're having a hormonal flare-up, this can make spots worse. So often women find that when they're on their period or when they're pregnant, their spots or their acne flares up. So how common is acne? Well, it's super duper common. 95% of people will have some sort of acne from the age of puberty to about 30. And we know that by the age of 35, 3% of adults are still suffering with acne. So it's really common, and adult acne is actually still pretty common as well. People expect it only to be teenagers, but unfortunately it isn't. Right, there are lots of myths about acne. People think that you're just lazy and dirty and you eat too much junk food. Well, none of those things are true. In fact, the biological processes that cause acne are going on underneath the skin. So overwashing your skin more than twice a day can actually aggravate the skin more. So it isn't just about having dirty skin. Although it's good to keep the skin clean and the hair away from the face to avoid blocking the follicles further. And there's not great evidence that any kind of diet makes a difference for acne. Although it's a good idea just to try and stay as healthy as you can and eat lots of good green veg, etc. Don't bother putting toothpaste on your spots. It might just aggravate the skin and is unlikely to do much to help. Key thing to remember is do not squeeze those spots. However tempting it may be, do not squeeze them, because this can cause infection, but even worse, can cause permanent scarring. So try and leave the spots alone. So what should you do to treat acne? Well, the best tip I can give you is treat it early. Don't wait and hope it's going to get better. Get some help. The pharmacist can help. There's loads of creams and lotions available to buy over the counter, so you don't even necessarily need to make an appointment with your GP if your acne is quite mild. If those things don't help, or your acne is quite severe and you've got lots on your face, or you've got any on your chest or your back, or you're already suffering with scarring, then make an appointment to speak to your GP. There's different treatments that we as GPs are able to offer. There's creams and lotions, things like benzoyl peroxide, there's retinoids such as adapalene, there's antibiotic creams, or there's even antibiotic tablets that we try sometimes. Now you have to be patient with all of these treatments for acne, because we usually think it's going to be about 12 weeks before we can even decide whether or not a treatment has worked. So unfortunately there's no quick fix here. Some women prefer to try the oral contraceptive pill and see if that helps them. Often we find that the mini pill or the progesterone only pill actually makes acne worse, so you're better off not going on that. If you've tried all these steps and it hasn't got better, or if your acne is very severe, you've got a lot of scarring on your back and on your chest, or if you've got significant mental distress associated with the acne, then your GP can refer you to the dermatologist. The dermatologist can consider prescribing something called isotretinoin, which is a tablet often known by the brand name Accutane. Now this has to be considered because it has got significant side effects. It can cause liver problems. Women have to be very careful not to get pregnant when they're taking isotretinoin. And it can even affect your mood and cause depression and even increased suicidal intent in some people. So the dermatologist has to review all those factors, so it's individual case by case basis. But if it is suitable, then we know it's a really effective treatment. So 4 out of 5 patients on isotretinoin have clear skin within 4 months. So it works really well. Having said that, we do know that acne will wax and wane and often keep flaring up. So it's about controlling the acne rather than curing it. So my top tips are: seek advice early, either from the pharmacist or book an appointment to speak to your GP. Keep your face clean but don't overwash. Remove makeup before bed and try and avoid keeping your hair in front of your face. If you're going to use makeup, try and use makeup that's good for acne. Often it will say on it. And Don't sit in silence hoping it's going to get better and worrying about it. So do come and get help, especially if your mental health is struggling, because we know that it can really take a significant toll on your mental health. So do come and ask for help. All right, I hope you found that helpful, and hopefully your skin can be cleared up. But remember, it's not a quick and easy job, and we're looking after control, not cure. All right, thanks for now. See you in my next video. Bye-bye.